Well, at this point, we don't have any formal position statements or policy statements on nurse wellness, but ANA is absolutely committed to the health, safety, and wellness of the nurse. In fact, I've just recently joined ANA, and they brought me on to shift our Center of Occupational and Environmental Health to become the Center for Health, Safety, and Wellness. And we're going to be focusing there on promoting the professional and personal health of the nurse and the nurse profession. We're so busy caring for others that we forget to care about ourselves. Our whole healthcare system is actually shifting. It's shifting from a reactive disease model to a proactive health promotion and disease prevention model. Our top 10 causes of death are actually caused by poor behavior choices, the cancers and the diabetes and some of those things. It used to be acute conditions like polio and plague, and we really have shifted over. These choices, though, are ultimately the responsibility of the individual for these behavior choices, but it's also important that the community and the environment and policies in which the individual lives works as a part of this. And nurses have a fabulous opportunity to make a difference. We know health. We know what to do about it, how to teach it. We are 3.1 million strong, and we are 1 in 100 Americans across the country, so we are embedded in every community that's out there. But the biggest piece is that we are the largest healthcare profession, and we're the most trusted. I think probably one of the biggest ones is shift work causing a lot of fatigue. It causes a lack of healthy food choices because the cafeterias are closed, the vending machines are out there with all of their candy bars. We are in a high stress with life or death situations that leads to compassion fatigue, and it leads to stress eating. And another thing that we have are some of the work hazards, the chemicals and the needles and patient lifting that causes problems. So again, I think we have a great opportunity to be stronger role models, advocates, and educators. We adopt these habits so that we can be healthy, so that we can live and enjoy our lives to our greatest potential and around all 5 dimensions of health, around our physical, emotional, spiritual. But while our initial focus is our personal health, the collateral benefit is that we're happier and more productive, not just for ourselves, but within our family, within our work environment, and within our communities. Because we're people first, too, we can share our struggles for our healthy choices with our patients, especially when we have less formal education time with our patients. So if we can just be healthier and share our stories with them on that point of service education moment, it makes a difference. So it's going to be an all-day conference. It's preceding our biannual House of Delegates, so it's going to be a big deal. So the focus is going to be nurses as models of wellness in action. The goal is to inspire nurses to integrate health and wellness and healthy habits into their personal and their professional lives. Now, the keynote is David Maxfield, and he's a dynamic speaker who's going to share his thoughts that from his book, Change Anything, to really show us how we can make some of these changes. Some of the other topics are going to be some instant stress busters for nurses, tools for living fit, sleep loss and fatigue, and some healthy workplace topics to include chemicals and safe staffing. There's also going to be some fun breaks interspersed throughout, such as salsa in your seats, and we're going to have healthy food. And then the day is going to end actually by our CEO challenging all nurses to commit to one behavior change, no matter how big or how small. And we're actually going to hand out these little green cards, and we're going to have them write it down, and we'll collect them and then mail them back to them in 3 weeks to remind them of their commitment, because it takes 3 weeks to make a behavior change. So it should be a very fun program. Although we know healthy behaviors and we teach healthy behaviors, we aren't always motivated to live these healthy behaviors, and for a variety of reasons. So I think the key is for us to identify ways we can and want to make these changes and how to overcome those barriers. The changes can be as little or as big as we want. But some of the little things would be to just one less sugary drink a day. But some of the other things that we really want to stress is, some little steps is to maybe take the stairs at work or do random acts of kindness. Get your mammogram done. We nurses have the power to make the difference, both personally and professionally. That's probably the key message.